So let's start by talking about what is an eating disorder. An eating disorder is a severe disturbance in one's eating patterns and behaviors, as well as their thoughts and emotions. So there are three different kinds of eating disorders. There are a ton more, but the three main ones that I will be talking about today is anorexia, bulimia, and binge eating disorder. So, um, the first type of eating disorder that I will be talking about is called anorexia nervosa. So, anorexia nervosa is an eating disorder which is characterized by abnormally low body weight, an intense fear of gaining weight, and distorted perception of weight. So, the signs and symptoms for anorexia vary from person to person, but the few physical symptoms that there are is extreme weight loss, dizziness and fainting, constipation and abdominal pain, irregular heart rhythms, as well as lethargy, which is extreme fatigue. So, like I mentioned, everybody's body is different, so they will react differently to the disorder. But typically, more serious complications can occur over a period of time. So those things are including multi-organ failure, loss of menstruation in females, brittle nails and hair loss, and one's body temperature can actually drop. So the second set of symptoms that someone can have is behavioral. So those tend to be more things like frequently skipping meals, denial of hunger, not eating in public, and also they can have a reduced sex drive. People also tend to use laxative enemas, diet aids, and or herbal supplements or products. So the next topic is psychological effects of anorexia. So often those who have anorexia also have another set of mental illness. So that could include OCD, a mood disorder, personality disorder, anxiety and depression, and in severe cases, people will use substance abuse. So 40% of people will also self-harm, which includes cutting, burning, scratching, and again, in very serious cases, suicidal ideations and suicide attempts are possible. So, what causes anorexia and what are the risk factors? So, those are biological, environmental, and psychological. As for biological, there is still a lot of research that is being conducted, but there is a possibility that specific genes, it's not yet proven which ones, can make certain people at risk for developing anorexia. Environmental is exactly what it sounds like. Our society emphasizes the need to be thin all over social media, which is providing highly, highly unrealistic standards for teens to compare themselves to. It's also possible that being around those who have anorexia can trigger the process of it too. And then the last one is psychological. So individuals who have highly obsessive personalities can also make it so that they form a very rigorous or set in stone plan to not eat. They also tend to be perfectionists, so they push themselves to extreme levels to get the results that they want. though those results are never actually good enough for them. And this is usually caused by severe anxiety. So, who is more prone to getting anorexia? Girls are much more likely to develop anorexia than boys. However, both genders can for sure develop it. Boys are more likely to develop it later on in their lives, whereas girls tend to develop it around when puberty starts, which is around the age of 13 to 19. So, the average age for girls to get diagnosed, though, is around 16 or 17 years old. There is also not one particular race that is more likely to get it over another. All are pretty equal. And those who are in judge sports are definitely more likely to develop anorexia as well because of their desire to be in shape as they possibly can. So those sports would be anything from gymnastics to wrestling to swimming, football even. So the prevalence of anorexia is about 0.9% of females develop it, and 0.3% of males develop it as well. So the amount of individuals getting anorexia is also increasing as the years go on. So although anorexia is the most common and well-known eating disorder, it is actually the least common for people to have compared to the other two. So prevention, how do we prevent it? So the biggest thing is communication with doctors, promoting healthy body images, encouraging healthy eating habits, explaining the consequences of the disorder to your teen or whoever is going through it. In most cases, people with anorexia will refuse treatment, so there is no way to 100% prevent it. But definitely involving a doctor can help with determining if these symptoms are truly anorexia or if it is something else. Also, simply just talking about it can make them realize that you are there for them emotionally, and that if they are struggling, they can talk to you about it. So there are also prevention programs that are available. So there is one that is called a universal / primary prevention program, which is targeted at everyone in a community to change people's attitudes and views about the topic. Another one is a selective prevention, which is aimed at those who are not yet showing symptoms, but they are at risk due to certain factors pertaining to their life. So that is typically aimed for people aged 10 to 13, which is usually when puberty starts to kick in. There is also the last one, which is an indicated / targeted prevention, and this is geared towards those who are already showing signs of the disorder. This is to help slow down the process and the rate at which it's starting, or to possibly completely prevent it from progressing at all. However, at this point, this individual still does not have the diagnosis of an eating disorder. Rather than being aimed at multiple people, it is narrowed down to one individual person. So treatment. Getting patients into treatment is extremely difficult, but it is also not impossible. And this is usually done with multiple people attempting to help the individual. So dietitians, doctors, and other mental health professionals who have prior knowledge in the disorder are often there helping with guidance. So that could be anywhere from the patient going to being hospitalized, going to therapy, and um, there is some people who get medication for it to kind of help lessen the anxiety and depression portion of it, but again, that is not proven to be totally effective, and it will not stop the progression of the disorder. So post-treatment, people who are done with treatment can, it's very possible that they can recover. With that said, about 60% of people do recover, 20% partially recover, or they relapse again. And the last 20% unfortunately do not ever recover, and they continue to live significantly underweight. So patients must continue to go to therapy even after being released from the treatment programs. Although they are healthy and they feel fine, the thoughts of being afraid of food and gaining weight will never go away. So, moving on to binge eating disorder. Binge eating disorder is a mental illness whose characteristics include episodes of binging food without the individual making an effort to make up for that binge episode. They do not excessively exercise, they don't purge, and they don't take pills or laxatives. So the signs and symptoms again vary from person to person, but the main symptoms are eating when one is not hungry, so basically forcing themselves to eat, eating at a very quick pace, feeling depressed, disgusted, or even guilty after overeating. Also, discomfort eating around other people or feeling embarrassed. So, again, unlike people with bulimia and anorexia, patients with binge eating disorder have little to no concern with their weight at all. So, the behaviors and psychological effects of binge eating disorder is low self-esteem, difficulties concentrating, depression, and anxiety, all very similar to the other two. But it is more common for people to also abuse alcohol and other drugs. So, causes and risk factors for binge eating disorder. Again, it's biological, psychological, and environmental. They are all very similar. Yeah. So, who is more prone for developing binge eating disorder? Those who are obese are definitely more prone to developing binge eating disorder or already have it. But it is also very important to note that not everyone that is obese has binge eating disorder. So about 3.2% of women are affected by binge eating disorder, and about 2% of men are affected by it as well. While the statistics sound pretty low in comparison to other ones, that is quite a lot of people who are overweight. So again, more women are prone to developing it than men. So how do we prevent binge eating disorder? One option that people have is cognitive behavioral therapy to talk about the feelings that they're having, the emotions, and ways to cope with that. Again, there is medications that can be given to help subside the anxiety and depression, but again, that is also not proven, and it will not stop the progression of the disorder. Nutritional counseling and weight management is an option to kind of help get on a healthier track. to lose some of that weight, but in a healthy weight, um, and also restoration management to kind of help, again, with losing the weight in the proper way, not too rapidly, not too slow, and getting someone at the healthy weight for their height. Um, and that's about it.